go ahead and get started. Welcome, everyone. Thank you so much for joining us today for our first informational webinar on wandering awareness and prevention. My name is Dr. Lauren Libero. I'm the autism specialist at the Department of Developmental Services. I lead our Autism Services branch, and I'm delighted to see all of you here today who are interested in learning about this really important topic. We're going to launch into our webinar in just a moment, but first we're going to start with a few housekeeping items. So I'm going to let Asami share some of those with you now.
Thank you. Hello, everyone. I'm Asami with the Community Engagement team at the department, and just a few things before we get started. We're offering Spanish and Mandarin interpretation today. Mark, our Spanish interpreter, will give the instructions on how to access the Spanish channel.
Thank you, Asami. We'll do that now. Muy buenos días a todos que nos acompañen. Si desean escuchar el programa en español, en breve aparecerá en la parte inferior de su pantalla un icono de un globo terráqueo que dice Interpretation o Interpretación. Puede seleccionarlo y de ahí puede seleccionar su idioma, Spanish o español, y así podrá escuchar el programa enteramente en su idioma. And for those listening in English, please note if there happens to be any comment or question given in Spanish, you can select the globe icon that will appear at the bottom of your screen momentarily. It says Interpretation, and then select your language, English, and you'll then be able to hear live rendering that comment into English. Thank you, Asami. Back to you.
Thank you, Mark. Xiao Tun, our Mandarin interpreter, will give instructions on how to access the Mandarin channel.
Yes, thank you. 大家早。如果等一下您要听中文翻译的话，麻烦您在下面的那一排，如果你会看到一个地球仪出现的时候，那边会让你选项要选中文，那这样子您就会进入这个听中文的这个模式状态。好，然后在结束的时候有问题的话，也可以提出问题，然后我将很乐意的为您翻成英文来询问这个讲员。谢谢您。Back to you. Thank you.
Thank you, Xiao Tun. We're also offering ASL interpretation for today's meeting. The interpreters have been spotlighted, so their video will always be displayed. Closed captioning is active. This meeting is being recorded and may be available on the department's YouTube channel. Materials were emailed, but are also posting them in the chat for you. You may send written comments via email to autism@dds.ca.gov. Next slide. Your controls for today's meeting are available in the Zoom toolbar at the bottom of your screen. Chat is open throughout the webinar, so please use it to stay engaged. We'll have the Q&A session during the last 10 minutes of the webinar, and you may submit questions using the Q&A button. You may also use the thumbs up to upvote a question. Feel free to use the raise hand button during the Q&A session towards the end of the webinar to come off mute and ask your question. Participants will be called in the order you raise your hands, so please state your name, speak slowly to support our interpreters. You can view today's slides in English, Spanish, and traditional Chinese. Hover your mouse over the top of the screen and select the tab English, Spanish, or traditional slides, or traditional Chinese slides. Lastly, please take a minute to complete the survey that will appear when you leave the webinar. Thank you, and I will hand it over to Dr. Libero to introduce today's webinar topic.
Okay. First, I'd like to welcome our two esteemed speakers this morning. We have with us Kate Movius, who's the founder of Autism Interaction Solutions, where she collaborates with individuals with lived experience to provide autism education to law enforcement and first responders in California. She has also worked with California's Commission on Peace Officer Standards and Training, or POST, specifically on the topic of wandering prevention and autism, and she also serves on the LA Found Task Force. With Kate today, we have Tim Travis, who's the Director of Community Services at San Gabriel Pomona Regional Center, where he oversees and develops innovative and quality services for people with intellectual and developmental disabilities. He's also been active in promoting water safety for individuals with disabilities. He's committed to advancing safety initiatives, and he's going to tell you more about those today. And so let's take a peek at our agenda. We're going to start with an introduction to wandering and awareness, including some of the data related to risks, and then we'll go over some practical prevention strategies and information on the new water safety campaign. At the end, we'll be sharing some resources and we'll have some time for questions and answers at the end. And I just want to thank everyone who registered and came for the webinar today. The turnout is really incredible. But we will be recording and sharing out all of the materials. So if you have colleagues who were unable to make it today, we would really appreciate if you would share the information with them after the webinar so that more families will have access to the information that we're sharing today. So with that, I'm going to pass it to Kate, and Kate is going to launch into our content.
Thank you, Lauren, and good morning, everyone. First of all, let's define wandering. Wandering can also be referred to as elopement or bolting. Sometimes you'll have families who say, my son or my daughter is a runner. And the definition is it's when an individual leaves the safety of a responsible person's care or a safe setting. And the behavior can result in trauma, injury, and death. And I want to take a pause here. This is a potentially fatal behavior. And thus far, I'm very sad to say, in this year, we have the highest rates of death as a result of wandering thus far since statistics were kept. Next slide. So the risks of wandering are many. They include drowning, fatal traffic injuries, encounters with strangers, although this is much less of a risk than many people would think, and encounters with law enforcement. But by far the greatest risk for this behavior is accidental drowning, and this accounts for approximately 90% of deadly outcomes. Another statistic that often goes with this is that autistic children are 160 times more likely to drown than typically developing children. So this particular risk factor is by far the gravest of all. Other dangers include anything that would involve being outside for a long time. So we have dehydration, heat stroke, hypothermia, falls or injuries, and physical restraint, which can result from interactions with law enforcement. The higher the support needs after a certain age, so after about 10 years old, the higher the support needs of the individual, so the greater the severity of their disability, the greater the risks. I want to just take a moment, however, to say that these risks are present throughout the lifespan in many individuals who have developmental disabilities, not just those who are children. Next slide, please. Continuing with our statistics on wandering, 50% or roughly half of children with autism will attempt to elope from a safe environment. And that's a rate that's nearly 4 times higher than their unaffected siblings. Now that number of 50% is probably on the low side because most families are not going to take the time to report. They may find their child, but let's just take a moment to take in the fact that this is a very prevalent behavior for individuals with autism. In a recent study of autistic children, over 40% of parents had suffered sleep disruption due to fear of elopement. I have personal experience with this, which I will get to in a moment, but you often have families that are really at the outer edges of their capacity because they're exhausted trying to keep their children safe. More than 1/3 of children with autism who wander and elope are unable to communicate their name, address, or phone number. I want to add too that many individuals who elope or take off don't feel like they're lost. So unlike a typical child who might leave the home and realize what they've done and stop someone and say, hey, mister, I'm lost, or I want my mom, and individuals with autism may either not have the capacity to speak, or they may have language, but they don't feel lost. That's a big difference in the risk factors. And then finally, half of families who support a person who wanders or elopes report that they've never received advice or guidance about elopement from a professional. So if we take a moment to think about how high the statistics are for this behavior, that it's at least 50%, these families are not being warned that this could be a potential risk. Next slide, please. So here is my personal experience with wandering. Aiden is my son with autism, and he's pictured here in the yellow shirt. That's his brother James in the white shirt. Aiden had his first elopement incident at the age of 3, which involved the Los Angeles Police Department. He was found right away at a neighbor's house. And this picture was taken a week after his last critical missing incident at the age of 14. At the time, we had our house on lockdown. We were very well versed on the risks of wandering. Aiden had been working on that behavior both in school and in ABA therapy at home since the age of 3, and he still got out at 14. He figured out how to open our double deadbolts in the house. I'm going to get to that in a moment because double deadbolts are not a good idea. He got out and he was gone for about 2 hours in Northeast Los Angeles where we live. Aiden was found at a major intersection at 5 in the morning without any clothing. He had not been injured or assaulted, which is a miracle, but he was hospitalized as a John Doe. He was hospitalized as an unidentified juvenile because my phone call with 911 had crisscrossed with them bringing him in. So that caused a whole host of systemic steps that needed to take place for him to be released. It was a very frightening time. That's really why I've created these programs, because I don't wish that upon any family, despite the fact that this was a happy ending for our family and for Aiden. It was still extremely traumatic for everybody. And again, we want to really try to prevent this from happening to our families. Next slide, please. So we're going to talk about 7 tips to help prevent wandering and the related tragedies that come along with it. What I want to emphasize here is, our experience as a family raising a loved one with autism was very typical of many other families in that, as I said earlier, we had no idea that this was going to happen. We had no idea that this was a great risk. The first time it happened when he was very little, you're sort of in the middle of it. You're dealing with a lot of chaos all the time. In those early days of diagnosis, you get your child back, and then it starts happening again and again and again. And as I just told you, this really could have ended in tragedy for Aiden when he was 14. So we really want to try to convey this information to our families. And again, make sure they've got all the tools in their toolkit so that their children remain safe. Next slide, please. First and foremost is swimming lessons and water safety. Remember that slide earlier where we talked about the extremely high rates of drowning deaths. So swim lessons cannot be emphasized strongly enough. These are crucial for children and teens with intellectual and developmental disabilities. It can be very challenging for families to access this service, but it can be funded by regional centers. The YMCA also offers swim lessons to those with disabilities. I will say that my son received adaptive swim lessons from our regional center in Los Angeles, and I think that that really may have saved his life. He started those lessons when he was 4. Also, for individuals who own a pool, there can be a sense of complacency where they think, well, my child can swim, but so they're okay. It's not that much of a risk. It is. Fencing is key and very important. Removing any kind of toys or anything that makes the pool attractive to a child, or I might add a teen or adult. We have to remember this is a lifelong risk factor for many individuals. We want to be sure that that pool is really safely secured. Also, water safety is paramount, obviously, and it's important to let families know that just because their child knows how to swim does not mean their child is safe in the water. If your neighbors have pools, if the family is on good terms with those neighbors, we want to make sure those neighbors understand that this is an individual who may engage in wandering and seeking water. Bear in mind, too, that when individuals enter a body of water, which the majority of those with autism who wander will do, they will seek out water. They will often enter water fully clothed. So they'll have their shoes on and their heavy clothes, and that can really add to their risk factors. Next slide, please. Secondly, we want to let our families know to secure their homes, both inside and out. And again, speaking from personal experience here, we had installed two-sided deadbolt locks, which we found out the hard way. Number one, Aiden, our son, figured out how to open them. He found the key. And number two, we found out from the support teams that came in after this that this is illegal and it's a fire hazard. So the best option and the safest option is a keyless push button lock, and you can see a picture of that. These are available to order from Amazon and various locksmiths. The family will have access to the code and they open it from the inside. And I can tell you it changed our lives in our home. There are many other options for security. So if budget is not really a factor, they can get a whole home security alarm system, obviously. But for those who need a more reasonable or cheaper option, there are a lot of things that they can do. There are battery operated door alarms, simple hook and eye locks on doors. And then when we go to the outside, we want to have our yards fenced as best as possible. Even adhesive stop signs placed by the exit door. What I say to families is that anything is better than nothing. And by that I mean any step that they take is better than no step. These families, as we all know, are so overwhelmed. They have so many things that they're juggling. It often seems like this is impossible for them to manage. But it's up to us to really try to make it easier on them. And fortunately, there are a lot of great free resources available. Next slide, please. Third, we want to encourage our families to connect with their communities around this issue. So knowing their neighbors really helps to minimize the risk. Providing a letter to trusted neighbors that informs them of the child's tendency, or teens or adults' tendency to wander. We all know that some people don't have this option. They may not have neighbors that they trust or feel close to, but reaching out to community is definitely an important step in whatever form that may take. Also, we want families to make a list of all the places that their loved one likes to go in the community. That could be a park, a store, a restaurant, construction sites, grandma's house. For my son, it was a neighbor's house down the street that he loved to go into her yard. She had lots of fun stuff. That was fun at first, and then it became a problem as this behavior began to really increase. But the reason that we want to write this down for ourselves is because in the moment, it can be very difficult for families to remember these things. Next slide, please. And fourth, we want to contact our first responders before there's a crisis. And I want to really have all of us think about that sentence: before there's a crisis, let's prepare. Oftentimes this doesn't happen, as we all know. These families are living in active crisis every day, putting out fires every day. So preparing is really important. What information can we give our first responders? So first of all, we want to let them know, hey, this is my loved one. They have this diagnosis and they have engaged in wandering, or they might engage in wandering in the future. And I just wanted you to know that. Ideally, visiting the local police department is a great idea. If you live, as I do, within the LAPD district, it's very challenging to be able to get an appointment, but they're very happy to meet with families. If you can bring your loved one to the station, not feasible for a lot of families, I understand, but if you can, that's a really good thing too, to familiarize your loved one with the sight of a police officer, with what the uniforms look like, and again, to let that neighborhood department know that you're there and that your loved one has this vulnerability. We also want to do this with our local fire departments as well. A lot of police departments have a voluntary special alert or address flagging program. So what this is you go in, you can do this on the sheriff's department for Los Angeles, for example. You go in as a family or as the loved one and you type in the information, your address, the individual's diagnosis or risk factors. And this is a really important way to minimize the risks of law enforcement involvement. Because what happens is if there's a 911 call, the dispatcher will see this information and relay that to the responding officers. And if you can imagine, I think about this with my son, who's now 25 years old and 6 feet tall when he's on his tiptoes, which he likes to walk on. If he's running up the street and law enforcement comes and he doesn't respond to their requests to stop, or he turns around and starts behaving in an unusual way and they do not have the information, that really puts everybody at far greater risk. We really want to get this information out to our responding first responders as best we can. So these voluntary registry programs are really good for this. We also want to encourage our families to have informational handouts on their loved ones. And you'll see some links here. And this is a really good example of the great free resources available to our families. There are personal emergency profile sheets. The National Autism Association, or NAA, is a very, very good resource, very thorough resource that's online for families so that they don't have to do a lot of extra work. They've got some of the work cut out for them certainly, but they have some of the work done for them as well. Next slide, please. Obtaining a tracking device. Again, this was a game changer for our family. There are lots of different tracking devices out there. And as we know, with autism at least, and certainly with other developmental disabilities, there's a lot of sensory complexity there. It can be very challenging for somebody to wear a device. And you see here pictured, that's the Project Lifesaver wristband. And that's what we have available free of charge in LA County through LA Found. What we did for our son is we did 6 months of behavioral work with his therapeutic team to try to desensitize him from wearing the wristband. And he successfully wore it for about 18 months. And this enabled us to get much better night's sleep. So we have different forms of tracking. There are QR codes that you can sew into someone's clothing or put on a shoe tag. There's GPS tracking, there's Angel Sense, lots of different programs. As I said earlier, anything is better than nothing. So if a family is very resistant to this, and there are many reasons why they might be, which are very good reasons, it's important to let them know that anything is better than nothing. And if a child or a teen or an adult can be tracked, that will improve the chances of a successful outcome. I do want to mention that Project Lifesaver has a 100% successful retrieval rate for people who are lost or missing. That includes Alzheimer's, dementia, as well as developmental disabilities. Next slide, please. Next, we want to create a safety plan. So again, this is before the crisis occurs. So if an individual has a tendency to wander, or if a child receives a diagnosis for a disability where we see much higher rates of this behavior, maybe they haven't wandered yet, but they're 3 years old and they have autism, it's really important to start addressing this in more official ways, if you will. So reaching out to the school and creating an IEP, putting this into the IEP, because many of these individuals go missing from their schools and their day programs. Also working with their regional center team in the IPP and making sure that everybody's working together. Because as I said, when I started this webinar, this is a potentially fatal behavior and a common behavior. Sharing information will help the school prepare for this, and documenting it in the IEP, of course, is the best way to ensure that they prepare. And providing a letter to the school district or the adult day program requesting that any incidents of wandering, even if it doesn't seem like much of one, even if the individual just bolts out and they get him right back, that needs to be documented as a wandering incident. Again, you can see there are some links to resources that provide templates for these letters to work with schools, work with day programs. Next slide, please. And finally, creating and posting a 911 checklist is very important. I can speak from experience. When your loved one goes missing, you're not always thinking very clearly. And when you call 911, your mind just goes blank. The dispatcher does talk you through it. They will ask you the name and the address. And the parent, or let's say it's the day program calling, needs to say that this individual is missing, endangered, and then provide the diagnosis. That last piece of information is often omitted because people are in the moment and they're terrified. The diagnosis is extremely important. Again, remember those responding officers or the fire department needs to have that information going in, because that will help them to try to communicate with and de-escalate the individual. Also providing the child's name, or again, teen or adult's name, age, height, weight, and clothing. This is where I failed my son miserably. I had no idea what he was wearing when he was missing. We have a really easy way to tell families to prepare for this, which is take a picture of your child when they leave the house every day, and take a picture of your child when they go to sleep. Making sure you know the color of those pajamas, the color of that shirt and those shorts and the shoes, because in a time of crisis, these are the really crucial details that individuals will often forget. Here's two more extremely important pieces of information for our families. One is to call 911 immediately. And you'd be surprised, most families don't. They don't call 911. They go out and look for the child themselves. I am guilty of this. In my son's critical missing incident, I looked for about 20 minutes before I called 911. That was an incredible error on my part. I should have called right away. Many families feel embarrassed, or they feel, there are many reasons to not call 911 for the family. They may feel, oh, this doesn't justify it. What if I find him under the bed and then I have to cancel it? There's that. And there's also the real fear of police involvement with their child or their loved one. But this, it's been statistically shown, calling 911 immediately really helps give that individual the best shot of coming home sooner. And the second really important piece of information is to check water first. Really know where all the bodies of water are close to the home. Most individuals who drown will drown very close to the home, within a 2-mile radius. There's an easy way to do this, which is Google Maps. So advising families, if they have access to that, to check their Google Maps and check all those bodies of water that are close by. and then advising first responders who arrive on scene to check water first. So again, always call 911 immediately and check water first if someone you support or care for is missing. And that brings us to the end of these wandering tips. And next up, we have Tim Travis, who will bring us through their wonderful program at the Regional Center.
Oh, good morning, and thank you, Kate. My name is Tim Travis. I work in the Community Services section at the San Gabriel Pomona Regional Center, or SGPRC. Our regional center is one of 21 regional centers statewide and one of the 7 regional centers in Los Angeles County. I want to thank DDS for the opportunity to share information about our regional center's water safety campaign. Next slide, please. So May is Drowning Prevention Month, although we should always be vigilant. As we head into the warmer months and begin to enjoy California's waterways and pools, it's important to take water safety steps to prepare ourselves and our loved ones. Drowning is one of the leading causes of death for children and young adults. Governor Newsom urges Californians to spread awareness on water safety and help protect others from these preventable tragedies. In California, drowning is the #1 cause of injury-related deaths for children under age 5. It's the #2 cause for children ages 5 through 14, and is the #3 cause of death for teens and young adults ages 15 to 24. Next slide. Each year, more than 430 Californians lose their lives to drowning. Many others survive, but may have long-term health needs. There are nearly 750 individuals receiving services from regional centers statewide who have experienced a near drowning incident. Individuals with intellectual and developmental disabilities, including individuals with a diagnosis of autism, are at a higher risk of drowning due to wandering or limited awareness of dangers. That's why prevention is especially important in our community. Most drownings happen between the months of May and August, and they often occur quietly, without splashing or cries for help. Learning how to reduce risks around water is an important part of keeping everyone safe. Next slide. Through gracious funding from DDS and in partnership with the Prevent Drowning Foundation of San Diego, SGPRC has launched a campaign to share information about water safety and drowning prevention in the community we serve. The Prevent Drowning Foundation of San Diego was awarded funding to assist our regional center in developing a swimming safety and drowning prevention campaign to help individuals we serve, their families, and our community learn water safety. I'd like to introduce you to Ollie the sea lion. Now you may ask yourself, why a sea lion? Well, for those of you who live near or have visited California's beautiful coast and beaches, know that sea lions make a lot of noise. So we want our children and adults to make noise to alert others if they are having trouble when they are in the water. Ollie has been very busy the last few months promoting water safety throughout the San Gabriel and Pomona valleys of Los Angeles County. He has been at different events, eco fairs, aquatics events, and in July, we'll be expanding to nighttime swim events in local cities. If you're in the area of Pomona or Laverne, come by and visit our booth and get some water safety tips and also get an Ollie cape. Next slide. At each event, we share information to help individuals and families learn about safety, like this postcard that has important water safety tips on one side in Spanish and the other side in English. Ollie reminds us that we should use barriers and alarms to secure entrances like gates and doors that lead to pools and other sources of water like ponds and fountains. When people are near the water, like the ocean or a pool, they should always be constantly supervised. We really want people to learn how to swim. One thing that we are finding out during our campaign efforts is that many parents and grandparents of those individuals that we serve don't know how to swim. So we need to make sure that everyone in the family learns how to swim. If you're out on a boat in one of California's lakes, rivers, or ocean, everyone should wear a life jacket. People should also learn CPR and rescue breaths. But most importantly, as was mentioned earlier, if a child or someone is missing, always check the water first. Every second counts. Next slide. So Ollie is our mascot, and Ollie has been launched on social media, sharing regular swimming safety tips on Facebook, Instagram, and X. Next slide. His campaign can be found both on the department's website as well as also SGPRC's website. So definitely follow us for different safety tips and information about where we'll be having our campaign. Back to you, Dr. Libero.
Thanks, Tim. We have a few more resources that we wanted to share with everyone. On this slide, we have some direct links to San Gabriel Pomona Regional Center's water safety campaign that Tim just walked you through. We have links to the National Autism Association and the National Autism Safety Council that have various different free options that individuals and families can download that include safety checklists, safety plans, and some other really great informational resources there. We have the link for Project Lifesaver that Kate told you about. This is available in lots of different places in California, not just Los Angeles County. So you can check on the website whether you have a local option available and who to connect with if families are interested in that program. We have two DDS links. One is to the DDS water safety page that has a lot of different resources around water safety, lots of translations there for accessibility. And then another link to the National Autism Association specifically about wandering. And then I also wanted to mention that we have created a handout, a PDF that you can share with your individuals and families with some of the great information from this webinar today. So we'll be dropping that into the chat as well today and sending that out with our materials. And we're going to start our question and answer session in just a moment, but I wanted to walk you through a little bit more information before we do that. So we do have a companion webinar for individuals and families. This is coming up on Thursday, June 11th. It'll be at 11:30 in the morning. We have a flyer that you can send out to the individuals that you support. And if we can go about 2 slides ahead, we have the QR code there as well. If you want to grab that link, you can save it and email out the registration link to folks as well so they can receive this information directly. And then on the next couple of slides, we have our contact information. So if you're interested in connecting with Kate, learning more about her educational work and the work that she does with first responders, you can reach her at the contact information here on the slide. Our next slide has the contact information for our friends at San Gabriel Pomona Regional Center and the link to their water safety website. And then our last link here is for our Autism Resource Hub. So families can access some of this information on the hub as well as other information about autism. And they can also reach out to the department directly if they have questions or want to connect with us. They can email or call us the contact information here on the screen. So with that, I do want to thank everyone for coming, listening intently. I can see we have a few questions that came in the chat and the Q&A, and so we're going to start addressing those now.